So my name is Daniel Gowan. I am co-founder of D2 Counseling. My co-founder partner is Dr. Dina Hijazi, who's with us here tonight. And we want to thank you and welcome you to our presentation of this month's edition of the Dallas Free Lecture Series. The Dallas Free Lecture Series is co-hosted by Unity Church in Dallas, where we do this in person when we don't have a pandemic. We'd like to thank you all for attending tonight to hear. And I want to point out a couple of items around housekeeping. I posted in the chat how to get a hold of CEUs. If you'd like those, you can send us an email at info at. You can get the CEUs at info@d2counseling.com. I put that in the chat. Also, I would like to point out that we get better reception and have less outages if everybody turns off their video. If you'd stay muted until the end of the program, that would be great too. Then we have less interference with small children, animals, and dinner. Finally, June 16th, join us back here next month with Drowning in Unfinished Business, A Way Out, with a favorite of mine, Julie Patrick, who's just a dear to work with and who is presenting that night. So with that, I'll give you Dr. Dina Hijazi.
Hi, everybody. I'm Dina Hijazi. So glad you're with us tonight. We have a wonderful speaker, Jacqueline Katz. She's actually a therapist with D2 Counseling, and we're so fortunate to have her. Jacqueline has spent most of her career honing her skills in EMDR, and she has fairly recently started the long training of somatic experience practitioner. There are only a few of SE practitioners in Dallas because it's such a lengthy and intense training, and she is close to completing it. So she's got a lot of training, a lot of gifts, and a lot to offer you all tonight, and I hope you enjoy the presentation. Thanks, Jacqueline.
Thank you. Good evening, everybody. So just a reminder, as that a few of you have just joined us, make sure that you mute yourself, and we will probably have a more secure connection if you also turn off your video camera, and then we'll come back on together later in the program. So I want to thank all of you for being here tonight. As Dina said, I have worked for most of my career honing my skills as an EMDR therapist, and through my own trauma work have discovered the use of the body, especially through yoga and healing. And it was kind of a natural transition for me to begin SE training, which does take a really long time. And so it's quite a commitment, and it has profoundly changed my life. So in saying that, I have a lot to talk about this evening, so we'll get started. Maybe we'll get started. Okay, so our objectives this evening are to learn how trauma is stored in the body and understand when you store it, what the effects are on the body as well as the body systems. And then also throughout, I've peppered spaces where we're going to practice some techniques that can be helpful in both regulating your body systems and releasing trauma from the body. So let's go ahead and take a few moments to breathe. Quite often we don't pay a lot of attention to breathing because it is part of our involuntary responses in our body, and our body breathes for itself, but not always adequately. So just notice your breath right now and the depth of your breath. And maybe if it feels useful to you, inhale very deeply, filling your body with air, and imagine that that air is going about 2 inches below your belly button. And then as you exhale, exhale fully and completely. And when you get to the bottom of the exhale, maybe pull your belly button towards your spine and push out all of the air. So a few more rounds like that, inhaling completely and exhaling slowly and completely. And just notice what happens with your body as you breathe. Perhaps your ribs expand, maybe you feel an opening in your chest, or maybe not. And on your next exhale, just allow your body to breathe itself in whatever way you find useful. And I'm just going to invite you throughout our presentation this evening to just be aware of the breath in your body. So I first want to cover the question of what is trauma. And as many clinicians as there are in this room, in this place together, this common space, there are probably as many definitions, and as well as to people who are not in the helping professions. We all have an idea of what trauma is. Judith Herman, who is an expert and pioneer in the world of trauma, says that traumatic events are extraordinary because they overwhelm ordinary human adaptations to life. And, you know, lately we've been talking a lot about the pandemic and how we are having an ordinary or normal response to an abnormal or an extraordinary condition. So traumatic events are those that are extraordinary, and our human adaptations do not allow us to properly deal with them or cope with them.
Jacqueline, I'm
Yes.
so sorry to interrupt you. We have several people that are still unmuted. So Jacqueline, could you please mute everyone again, or can I?
Yeah, I'm going to
everybody
ask you all to
check?
try to do that. Otherwise, I have to go through all the individual screens.
You shouldn't have to. You should be able to click on participants and mute all.
Okay.
The way at the bottom.
Oh, I
We've
see. Ah, thank you.
You got it?
Got it. Thank you. Yeah, I heard little babies in the background. Okay. Peter Levine says that trauma originates in the nervous system. It is not an event. So it is not the event, it's actually when the nervous system is activated that causes the trauma. Specifically when the nervous system is blocked in expressing some of our natural responses, which we'll talk about later. And some more somatic or body-centered answers to that question is that trauma occurs when there's a breach in your boundaries. It also results when there's an incomplete fight, flight, or freeze response. In some way, it is blocked or thwarted, and that causes a trauma reaction. It's also we can define it as a dysregulation of the central nervous system. Trauma occurs when arousal in the nervous system becomes too overwhelming, or when that arousal comes too fast and too much. So I think specifically around that trauma, it's the shock trauma, it's unforeseen events, it's accidents, it's catastrophes, and those are things that are just too much too quickly. So in EMDR, we talk a lot about big T and little t trauma. in an effort to explain how little t trauma is significant. Quite often we think of very overwhelming events as being the ones that are traumatic. I have a lot of clients that come into the office and they'll say, yeah, I don't have any trauma. And then when you start asking questions, you realize that they do. It's just what we call little t trauma. So big T trauma is the big stuff. It's the major events. It's the kind of events that cause PTSD. Little t trauma, they can be overwhelming experiences, but we might not look at them as being traumatic. However, they may cause regulation difficulties. We may have difficulties with our self-esteem because of them. And then they cause difficulties with focus and with concentration. And so when we talk about big T trauma, this is a huge list, but just take a moment to look over it. You know, it's severe cases of emotional, physical, and sexual abuse, or exposure to the elements, and that's especially so in our littles. It's witnessing or experiencing violence, natural disasters, pandemic is on here, automobile accidents, something that people don't always think about, which is birth stress, both of the mother and of the baby. So birth is a particularly traumatic experience for a newborn. Being pushed out of their warm place where they're completely taken care of is less than ideal. So know that most people experience trauma just by the fact that they are born. And then if there are other things in play where there's risk to the mother, risk to the baby, or you are induced or pulled out with forceps or C-section, that is also a traumatic event. Then we look at little t trauma. And those are things like moving, starting a new job, getting divorced, minor injuries, and then also things like cultural oppression, so racism, sexism, ageism, most of the isms cause things that slowly deteriorate at your sense of well-being. And when coupled with other little t traumas, they're just as activating and troubling as many of the big T traumas. So we're going to practice a little regulation exercise. So let's all maybe close our eyes. And perhaps you can remember a time in the past week or 2 weeks where you have felt perhaps amused or happy or safe or some sort of positive way of being in the world. And as you remember that, just notice what happens in your body. As you think of the sensations that you experienced when that happened, the people around you, perhaps there's a smile on your face. You might notice that your breath deepens. You may notice your shoulders drop. You may notice a sense of clarity. And just be in that time for a moment. Noticing the things that you see around you, the colors, the textures. Notice the sounds that you heard. And as you're in that time, just notice the emotions that may come up for you. Very slowly, just without opening your eyes, maybe bring your awareness back into the room. Notice the sounds that you currently hear around you, the sensations against your skin, the temperature of the air, the smell. And then whenever you're ready, just slowly flutter your eyes open and come back into your space. And just notice what you're feeling in your body. And welcome back. That exercise is often useful as we experience anything that's mildly distressing in our days, is to just go back to when we didn't feel that way. I want to talk a little bit about basic polyvagal theory, and please know that polyvagal theory is probably a week in its own right, so I'm just going to touch on it. But later on, we're going to be talking about sympathetic and parasympathetic response in the body. And so our nervous system is separated when we think about voluntary nervous system, which is our SNS, or we have our involuntary nervous system, which is our ANS. And so voluntary is purposeful movement, things that we have control of. Involuntary would be things like breathing or our heart beating. And that is something that is automatic for us. So in our ANS, or our automatic nervous system, we have two responses. We have the sympathetic nervous system and the parasympathetic nervous system. And we try to keep a balance in those. Our body wants a balance in the sympathetic and the parasympathetic. So if you think about the parasympathetic, that is an inactive orientation. So that is when we are resting or downregulating, or in the case of trauma, that also might be where we become immobilized. So we want to activate the parasympathetic nervous system when we are aroused in our sympathetic in a negative way. So the sympathetic nervous system is action oriented. So when we're in a trauma response, that would be our fight or flight. Parasympathetic would be our freeze. So the sympathetic nervous system also is what keeps us active. So when we start feeling down or immobilized, we activate the sympathetic nervous system to keep it in balance. So part of feeling stuck, the opposite action would be to take action and maybe get up and move around. So at times when you start to feel heavy or burdened or immobile, that would be a time for you to maybe take action and get up and run in place or do some sun salutations so that you can get your body moving. So in our brainstem, we have the vagus nerve, and that runs down into our gut, and it splits off into the dorsal vagal and the ventral vagal. And so the dorsal vagal is what is responsible for, it's kind of the on and off switch of our parasympathetic nervous system. So it controls rest and digest. It also controls shutdown or immobilization. And then our ventral vagal is sort of the dimmer switch. So that's part of our social engagement system. That is also what calms us down and what can perk us up. So we can turn it down or we can turn it up, but we don't really have any control over how that happens, except for when to be very purposeful in activating this parasympathetic to balance it. So when we're in a trauma response, if the dorsal vagal becomes prominent, that's when we get into that place of immobility, or where we begin to shut down. The ventral vagal is the part that's going to start to bring us back up, and we do that a lot of times through social engagement. If you'll notice, some of you may be experiencing or have shared with friends that during this pandemic time, which is a time of trauma, it affects both the systems in our life and in our body, but it also affects our environment. So that makes it a complex trauma. Depending upon, you know, what else is going on in your life. But part of the way that we counteract some of the heaviness and immobility and maybe even fatigue that we're experiencing during this time is through social engagement. And many of us don't really have access to that right now, which is where being online has been a lifesaver for many of us, but it after a while does not allow you to deeply connect with other human beings, which is what we need to do in order to heal. Judith Heller said the same thing around we heal through trauma through our connection. So in a nutshell, when we're socially engaged, we have safety, and that's where the ventral vagal is activated. When we're in a place of mobilization, that's sympathetic. That's we're in danger, we're taking action, fight or flight. When we feel immobilized or that we can't do something, which is very often when we get into a life-threatening situation, that is our parasympathetic nervous system, and that is the dorsal vagal response. So our nervous system responds to the environment both inside our body and outside of our body. And our nervous system responds always knowing whether we're safe, and that's where we're engaging with others. And we do that through prosody, through our voices. We do that through eye contact, through facial expressions. And it helps us to support our visceral balance, which is our internal organs. If our nervous system feels that we're in danger, that's when the defense strategies come up. So that's when we are in fight-flight behaviors. And then if we perceive something to be life-threatening, that's when we go into the defensive strategies of immobilization or feigning death or shutdown, or sometimes even fawning can be a life-threatening situation. So symptoms of trauma, and this is based on the work of Peter Levine, who is the one who developed somatic experiencing. He looks at symptoms as trauma, and they're in this order as constriction, hyperarousal, dissociation and denial, and then feelings of helplessness, immobility, and freezing. So with the hyperarousal, you know, that's maybe if there's right when you encounter a sense of maybe danger, or you might have tingling, you might have some muscle tension where some of your muscles constrict, you might have panting or shallow breathing or sweating. And if you let the constriction have a natural flow in your body without trying to deny it that it's happening, eventually you'll go into usually some shaking or some waves of warmth, and then your breathing will become deeper, and then you'll start feeling maybe a mild comfort coming with the breathing slowing down and becoming deeper, and it can pass. Sometimes when we have a fear response, we deny that, and that constriction stays in our body. And so, I'm sorry, that's with hyperarousal. I don't know how constriction is just the tightening of the muscle tone and the posture and those things. Then we get into dissociation and denial. And so Peter Levine feels like denial is kind of the softer, lower level version of dissociation, which does make sense. Oftentimes we deny that a trauma is beginning to happen to us, or that a danger is coming towards us. And we do that by acting like it's just not there, or completely dissociating and taking ourselves out of that system because it is so overwhelming. So a lot of times clients will come in with chronic pain, and very often chronic pain is a result of denial or dissociation from a traumatic event. And then lastly, if you are unable to complete a fight or flight response, often there's feelings of collapse or immobility that happen. So there's a helplessness and a heaviness in the body and an inability to feel like you can take action. And so when we look at specific trauma symptoms, there are some that come exactly with the time of the trauma or very shortly after, and here's a pretty exhaustive list. But you know, the startle response is definitely there. When we talk about exaggerated emotions, that could be the fear. It could also be some people try to make light of situations and excessive laughter. There's intrusive images. People may have flashbacks. They might find themselves hypervigilant at all times, so easily startled. Sleeping difficulties. And because of their low-lying trauma symptoms, often they're not able to deal with any stressful situations. It's just too overwhelming. And then shortly after, and when we say shortly after, we mean it could be a month to several years. The later trauma symptoms appear. So panic attacks, general feelings of anxiety, difficulty bonding with other human beings, loss of beliefs about yourself and who you are. Sometimes self-mutilation, like cutting, or disordered relationships with food come to the surface. And then just fear, general fears, you know, phobias, but also fear of dying or that your life is going to somehow be shortened. And then we have avoidant behaviors and often addictions. So addictive behaviors are sometimes, most of the time, a sign that there's been some sort of trauma experienced in the lifetime. So the last symptoms that appear are the ones that I want to focus a little on, which is the fatigue, the low energy, the immune system problems, headaches, back problems, migraines, fibromyalgia, the chronic pain. Many people present with those symptoms, and a lot of time it's not a structural situation, it's trauma that's trapped in the body. So we also have digestive problems that come up, feeling detached from other people, from yourself, feeling isolated, chronic depression, and just an inability to plan for the future. Because if you think about having, you know, a feeling of helplessness or hopelessness, there is no future. So it's really difficult to lay plans. So let's just take a moment to regulate after talking about all of that. And one of the ways to regulate and to when you're aroused or activated. So think of maybe a time when you have felt just an adrenaline rush that has caused rapid breathing, or you can't think and your mind is racing. And one of the ways to calm that is to do VU breath. So VU breath, meaning VU, is a breath that you take you inhale deeply, and as you exhale, you from below your rib cage, you generate the sound of boo, and you do it your entire exhale, and then you just let your body breathe and regulate. So we're going to try this, and we'll do it twice so you can notice what happens. And see, nobody can see each other, so this is a good thing. So inhale and exhale. And then we're going to inhale together. And just let your body rest and breathe. Sometimes people feel a lightness in their chest. You may also feel that down into your pelvic floor. There's a lengthening of the area in the diaphragm. And let's just do it one more time. Inhale. And then just breathe. So that vibration also brings homeostasis to the internal organs, helps support them. And then just one last exercise in regulating yourself. And for those of you, especially that aren't able to hug or touch loved ones, often holding yourself is quite helpful. So taking your right hand and then just gently placing it under your armpit. So not pushing up in there, just placing it there. So you can almost feel the warmth on the side of your rib cage from your hand. And then taking your left hand and placing it up on your upper arm. And then just letting your arms relax. And feel the warmth of your hands. And just gently hug yourself. So sometimes rocking is very soothing to the body, and I find that I automatically do that. But if that's something that soothes you, maybe even just really slowly introducing a rock. You may start to notice that your heartbeat is coming up into your left hand, or your right hand on your left side. And then as you're ready, just allow your hands to come down. Or you could stay like that. Your choice. So there are a lot of physical traumas that happen, or physical consequences that happen in the face of trauma. So definitely there's psychiatric distress, and reminders create a sensitivity. So triggers back to the trauma reactivate that stress if that trauma has not been resolved. So if you think about trauma that has not been resolved being stuck in your nervous system, and every time that there's some sort of reminder or trigger of that, and that trigger could be in sensation or image or behavior or movement. Smell is one of the senses that brings us the most memory. We have a lot of smell memory, and so even smells can activate traumas. And then you have recurring stress from that trauma. Sometimes physical illness, which we're going to talk a little more about, is produced in that reaction to that trauma, or any distress that's associated with it. And it's anything that is outside of our window of tolerance. So our window of tolerance is how well we're able to handle things. Some people are able to handle more stress or more trauma than others. And so anything that is outside our window of tolerance is going to be something that causes us distress. And then there's also the way that we cope with things. There are many people that, when I think about the work I've done with veterans, there are many that have come out of combat situations not as scathed as others. And so it really has to do with our emotional makeup as children and what we inherited and how we're able to learn to cope with things that determine how much physical or how severe physical consequences can be. So with the cardiovascular system, definitely high blood pressure can happen, and that can cause blockages in arteries. We are at higher risk at having coronary events if we are survivors of trauma. Also, our coagulation of our blood becomes affected, so that puts us at risk of having blood clots. Our immune system is also affected by trauma. Definitely the functioning overall of our immune system is affected. And when the functioning is reduced, then that makes us vulnerable for other diseases. Those autoimmune diseases are prevalent in survivors of trauma, and autoimmune diseases ultimately deteriorate our internal organs. So stress-activated immune cells play a major role in inflammatory diseases, and there's a few listed there. So migraines, arthritis, cardiovascular disease, interstitial cystitis, and IBS. So IBS is part of irritable bowel syndrome. It can be an outcropping from the immune system or from the digestive system, or both. So the effects on the gastrointestinal system is that you basically are more predisposed as a trauma survivor to having ulcers or having irritable bowel syndrome. You have a higher risk of having IBS if you have other disorders of the immune or musculoskeletal system, so the fibromyalgia or the cystitis will also make you more prone to having the IBS as well. Then trauma survivors, especially those that have had sexual trauma, they often experience chronic pelvic pain, sexual dysfunctions, infertility, miscarriages, unusual cell growth, which can lead to cancers, low birth weight, preterm delivery of babies, and then, endometriosis, pain with intercourse, or cervical dysplasia. That is probably also one of the things I really look for when I take a history from a client, is looking at sexual disorders or issues with pelvis, because often sexual traumas, especially when they occur in childhood, are not always remembered in the working memory, which does not mean they can't be treated. Then there's also musculoskeletal and pain disorders. So when we talk about musculoskeletal, we're talking about ligaments, muscles, fascia, discs, so a lot of back pain and back problems. And the severity of the fibromyalgia, for those people who suffer with that, is usually has a symbiotic relationship with the severity of PTSD symptoms. Then we have our HPA axis. So that's the hypothalamus, the pituitary, and the adrenal glands are the ones that are responsible for secreting cortisol, which is our stress hormone. Now, every single cell in the body has receptors for cortisol, but those glands work in conjunction to secrete them. So when we are in chronic stress, our cortisol levels stay elevated. So a usual stress response or trauma response is that after that occurs, we have a surge of cortisol, and then that dissipates. But when we are somebody who either has complex PTSD or perhaps unresolved trauma, or that trauma is continuing to be triggered, then our cortisol levels do go up. So with the elevated cortisol levels comes degeneration of the hippocampus. And so that is an issue in that it can often mimic the symptoms of Alzheimer's with the degeneration of the hippocampus. So general high levels of cortisol can make you prone to a lot of diseases in the body. So the HPA axis, which is the hypothalamus, the pituitary, and the adrenal glands together. If there is increased activity, we have that left column tells us, it's everything from obesity to melancholic depression to anorexia, panic disorder, OCD. If for some reason your HPA axis has been deteriorated from overuse or is no longer activated from chronic trauma, you're more susceptible to seasonal depression, fibromyalgia, hypothyroidism, rheumatoid arthritis, chronic fatigue syndrome. And then if it's disrupted in any way, that's where it causes inflammation in the body, as well as Cushing's syndrome. So when we talk about trauma energy in the body, remember that's the fight, flight, or freeze response. And that, if it remains in the body, can overload the nervous system. And when it gets stuck in the nervous system, it causes these issues of disease, of pain, and then psychiatric issues, psychological issues. So it's often stored in our joints and our fascial bodies. It can be stored in our muscles as well, but usually it's internal organs, joints, and fascial bodies. And so fascia, when we talk about fascial tissue, we think about every part of our body is held in a sac. So under our skin, there's a sac that holds in our muscles. It's kind of a white, sinewy material. And then under that, when we get to we go through our skin, and then the fat, and then the fascial bodies, and then our muscles. And then when we go into our internal cavities, there are fascial bodies that hold our internal organs as well. So everything's kind of like wrapped, and those tissues are the ones that are affected quite often by trauma energy. And I'm having a trauma problem in that my mouse is no longer working. Okay. There we go. So problematic physical issues that are very specific in space, so in our backs, or perhaps, you know, depending upon, and most people kind of know where they hold a lot of stress. Some people get headaches, some people have indigestion or palpitations, some people have abdominal pain, stomach pain. So depending upon where you hold that energy, it can cause very specific physical problems. So if you're somebody who gets headaches or holds it in your nervous system, quite often there are back problems or headache problems or vision problems. If you're somebody who feels a lot of things in your gut, in your stomach, there's ulcers, there's IBS, colitis, that sort of thing. And if you're somebody who holds things in your muscles, you can have atrophy of muscles, muscle pain, issues with ligaments and joints. So there are just different places, and then all of the body systems you can have weaknesses in, either all of the body system or part of the body system. So when the flight response, the fleeing, is somehow blocked, either you're telling yourself I need to run and you don't do it, or you're held down and you're unable to flee, or something of that nature happens. It could also be being locked in a car or stuck in an elevator, but that flight response is somehow incomplete. You can have anxiety as well as panic. And usually there is tightness somewhere in the body, there's trembling. If you're somebody who shivers a lot for no reason, that can also be a response of a blocked flight. There can also be issues with lower body, with legs, with anything that helps you take flight. Foot pain, ankle pain. The freeze response, so if some reason that you have that immobilization that becomes chronic, there are a lot of constrictions in the body. So again, you might feel atrophy or that you can't move. Sometimes people actually lose mobility in their joints or in parts of their body because of the constriction. It manifests itself somatically. If that constriction, it becomes so immobilizing that it becomes overwhelming, then that can result in you just dissociating from your body. So sometimes that constriction is so great that people don't even know what they're feeling in their body. So just knowing that I don't feel my body is a sign that there has been a traumatic event that has not been resolved. All right, so we're going to get up and move. Well, we're not going to get up. We're just going to move. So if you want to back up, if you're able to do that, I'm in a rolling chair, so I'm able to back up. And I just want to invite you, you can just stay seated and place both of your feet on the floor. And I wanted to invite you to either close your eyes or you may choose to keep your eyes open. So whichever works best for you, either eyes open or eyes closed. And you may choose to do these movements or you may just choose to sit still. So just begin by focusing on your body seated in the chair. And just notice what it feels like. Excuse me, I have to cough. Notice what it feels like to have your feet flat on the ground and have your feet be supported by the earth. Notice what it feels like to sit in a chair. Maybe you have your hands on your upper legs. Just notice what that pressure feels like. And then just begin to notice your head and your shoulders. And if there's any movement that may feel useful to you, just go ahead and do that now. Maybe move your head around. And then I just want to invite you to maybe move your head. So you could do this by either lowering your chin towards your chest and then bring it back up. Or you could do it by maybe moving your head to the right and then to the center and then to the left. So you could either bring your chin down and then bring your chin up to whatever level and come back to center. Or you may choose to move your head right and move your head left. And just making these movements really slowly and just noticing what happens when you do that. And if you're having trouble making that choice, perhaps you try both and then decide which choice is most useful. And then whenever you're ready and in your own time, just bringing your head back to neutral and maybe begin to make some movements with your shoulders. So you may choose to bring your shoulders up and then allow your shoulders to drop down. Or you may even choose to make some circles with your shoulders. So that's your choice. Either moving your shoulders up or moving them down or making circles. And if you're making circles, you may decide that you would like to stop the circle and go in the opposite direction. Or you may decide to just continue moving in the direction you are moving. It's your body, so it's your choice what you would like to do. And then you can either continue with this movement if it feels useful to you, or you may decide to stop. You may decide to maybe move your shoulders independently of one another. And then in your own time, bring yourself to a place of stillness. And I want to invite you to maybe experiment with moving your side body. So perhaps you take your hand and maybe put it to your side and you lean to the left. And then come back upright. Maybe if you want to add more movement to this, you place your left hand on your left upper leg and maybe you raise your arm up and move to the left. And just notice how that changes the sensation if you raise your arm up. Maybe you create some rhythm by matching your breath with your movement. You might even experiment with moving your shoulder. You may choose to stay in this place of reaching. You may just choose to match your breath and come down. And you can either continue in this movement towards the left, feeling the stretch perhaps in your right side body. Maybe you don't feel the stretch at all. Or you could stop that movement and perhaps lean to the right. And maybe you lift your arm up and reach to the right as well. You may notice that you have a different sensation on one side than the other. You may notice that you don't feel any sensation at all. And then when you're ready and in your own time, just bringing yourself to stillness. And perhaps placing your hands on your upper legs or on your knees or maybe even on the armrests if you have them. And I just want to invite you to maybe drop your chin down and arch your back. So really pulling your belly in and making an arch with your spine and looking down. And maybe then coming upright and bringing your chest up and forward and your chin up and creating the opposite curve with your spine. As a friend of mine used to say, unarching your back. And maybe you match your breath with that movement. So seeing if you can create a rhythm with your body and your breath. Your choice. You may even choose to just sit there and breathe. And if you're noticing sensations in your body, perhaps identify where you're feeling them. Maybe you feel it in your neck and shoulders. Maybe you feel it in your spine. Maybe you feel it somewhere else. And then as you're ready, in your own time, just come to stillness. And if your eyes are closed, you can open them up or just wait a while as I continue. So Bessel van der Kolk, when he was the medical director at the trauma center, said that the goal of treatment for PTSD is to help people live in the present without feeling or behaving according to the relevant demands belonging to the past. And so this is, this is in line with the trauma center program that I just completed. It also aligns with somatic experiencing, and it aligns with the philosophy of EMDR, where we are working to desensitize and reprocess events of the past so that they don't inform our present. So TCTSY is the Trauma Center Trauma Sensitive Yoga Program. And they have, it is a program for healing trauma through yoga, but also other modalities that are applicable to clinicians in their psychotherapy practice, in SE practice, in EMDR practice. So the first theme of TCTSY is experiencing the present moment, then making choices, taking effective action, and creating rhythms. So I'm going to just speak to those separately. So when we experience the present moment, that is interoceptive experiences. So interoceptive is being aware of what is going on inside your body. So having a sensory experience helps us to anchor our body in the present. So if I am sitting and noticing the weight of my feet on the floor and noticing the breath in my body and noticing the temperature of the room as it touches as the air touches my skin, noticing whether I'm hungry or not, just noticing, I am able to stay in the present. And being able to have that felt sense of what I'm experiencing in my body creates a container for me to feel safe. And our ability to stay in the present is in relationship to our ability to heal. We heal in the present by looking back at the past. We don't go to the past, if that makes sense. So in EMDR therapy, we keep one foot in the present and one foot in the past. We don't go completely back there. In somatic experiencing, we just look at the edges. We approach from the outside. We don't go directly in. And in trauma-sensitive yoga, we always stay in the present. And sometimes people have difficulties with that, right? With what's being triggered in the body. So you might have noticed when we just did that practice that, we started out by being present in the body, noticing what you notice. The second theme of trauma healing at the trauma center is making choices. So part of experiencing developmental or complex traumas is the lack of having choice. When in a traumatic situation, we don't always have any sort of choice making. We don't have any agency. That is taken from us, and that's one part of what makes it traumatic. So having clear choices in a non-coercive environment helps to alleviate that sense of powerlessness and helps us to heal from the trauma. So when I talk about a non-coercive environment, that means that the choice making is your own, rather than you can do this or you can do that. So you might have noticed also during that practice, I offered some choices, right? You could do this or you could do that. Your choice, your body. You have the agency to make those choices. So practicing that in your everyday life. Whether it's in a yoga practice, whether it's at work, whether it's in your relationships, but making choices and then offering others choices as well, rather than to be demanding or coercive. The next theme is taking effective action. So part of a trauma experience is being oppressed, being immobilized, being disempowered. So when that happens, often the residual effects are feelings of helplessness or being ineffective or not having, I have no purpose. So when an individual or ourselves are in that situation, being able to take action in order to fulfill your needs or your wants is very important. So it combines the inner body, what you're experiencing in your body, the interoceptive experience, and the power of making choices. So you may have noticed when we were doing that practice that at one point in time I offered or invited you to perhaps try two different things, and then you make the choice. So you experience what you experience in your body, and then you make the choice of which is the best for you. And I don't use the word best because you might not know what's best for you. So it's whatever feels useful. And one other word on taking effective action. I think that this is really important, especially with raising our children. There is an enormous amount of learning that takes place when we offer our children choices, and perhaps they take one that they find out doesn't really serve them, and they learn from it rather than us telling them this is what you need to do or this is the best choice, right? Let them do that. It also helps adults and littles with problem solving. And then the last theme is creating rhythms. So rhythms are between two people or many people, and that's the give and take, right? There's a moving together. You know, sometimes we meet couples that really just kind of work together as a team very well, and maybe in parenting, maybe even as simple as, you know, fixing dinner or getting the kids ready to go somewhere, or maybe even with being very intuitive and knowing what one another thinks. So when we experience, there's trauma when the rhythm of connectedness with others, and it should say, is disrupted. So our not being connected to other individuals can be traumatic because of the break in the rhythm. So the other part of trauma is that it affects us being able to regulate our own biorhythms. So perhaps we have sleep issues, and part of creating rhythms is for you to start with some good sleep hygiene and going to bed at the same time, and then creating a ritual around going to bed so that your body is supported and your mind is supported for rest. Perhaps there is a break in our eating rhythms. So it's not uncommon for somebody who's experienced trauma to not feel hungry, to not know that they haven't eaten all day. And so that gets disrupted, and so does our energy level. So very often there is a low sense of energy, there's a sense of being trapped, and there's a sense of immobility. And that is because the biorhythm of energy has been interrupted. So in our practice, you may have noticed me talking about perhaps creating a rhythm between our breath and our body movement. So anytime that you can create rhythms, that is extremely helpful into regulating your body systems. And I mentioned earlier that sometimes rocking can do that for us, right? It's very soothing to your body, to your biorhythms. That's why we rock babies when we're trying to get them to relax and go to sleep and to comfort them. All right, so we're nearing the end here. So I want to invite you into a practice of meditating, which can help us to also be in the present moment. So in this practice, you may choose to close your eyes. You may choose to keep your eyes open, but if you keep your eyes open, perhaps cast your gaze to the floor or into your lap so you're not disrupted by any visual imagery. And as you close your eyes or downcast your eyes, maybe inhaling your shoulders up, and then on the exhale, very gently and slowly dropping your shoulders down and allowing your shoulders to almost drape. Your arms will hang like curtains from your shoulders, and allow your hands to just relax, either on your upper legs or on the armrests or wherever feels useful to you. And you may begin this meditation by simply following your breath into and out of your body. And as you follow your breath, perhaps clearing away the clutter in your mind from things in the past. They cannot be undone. Clear your mind of things of the future, what you're going to do next, what's going on tomorrow. It's just a fantasy. And just stay in the present with your body in this moment. And if your mind begins to wander, just gently bring it back to your breath. And if any thoughts come into your mind, without judgment, just place them on a cloud and let them float by. And just slowly begin to deepen your breath. Notice what you're feeling in your body. Notice what's going on in your mind. Perhaps it's cleared a little bit, or a lot, or not at all. But maybe you find peace in your body. Just become aware of the room around you, the sounds, the smells, sensations in your skin, the weight of your body, wherever you're sitting. Maybe even if you have a back on your seat, pressing into that, feeling it supports you. And then whenever you're ready and in your own time, just slowly begin to open your eyes. So for those of you that want the PowerPoint, you can email me my references. I'll put this slide up. So you can either take a picture of the screen or write down my email. I will gladly send that to you. And I am now going to turn that off so I can see all. And if you would all come on, that'd be great, as long as bad things don't happen. If you want to, if you choose to remain your name or your picture, that's okay too. Hello, everybody.
Thank you so much.
Yeah, thank you.
Thank you so much. We
And you can,
Thank you.
would like to take the last 10 minutes. Good to see you all. It's so much better to see faces.
yeah.
We've got about 10 minutes left. So if you would like to ask a question,
Yeah.
please send a chat. Just put in the chat, which is down at the bottom. You'll see a little tab that says chat. Just send, I have a question. And when we call your name out, just unmute yourself and ask the question.
Jacqueline, while we're waiting for folks to come up with questions or write it down in chat, one question I've always had difficulty with, you talked about the idea of stilling your mind. And when thoughts come in, trying not to be judgmental when they come in. Can you talk a little bit more about that? Because the minute I sit down to try to meditate and get a thought, I think, oh, I shouldn't be thinking that, and I'm not doing it right. And you talked about it letting it drift away, and maybe you could say a little bit more than that.
So part of being present and part of mindfulness is that concept of self-acceptance. And, you know, I have heard more than 1,000 times people who I ask what their meditation practice is, and they say, I can't meditate. And usually that is a judgment upon themselves. Meditation is whatever you want it to be, but if you judge yourself as unable, then that ends the relationship with meditation. So part of that self-acceptance is being able to let whatever happens happen. Because in yourself, I shouldn't be thinking about that. You're shaming yourself at the practice of being present. And that is so personal, our abilities to be present. So rather than I shouldn't be thinking that, well, gosh, here comes this thought. I would like to invite you back later. And so, you know, I know some people take that practice of pushing it out of their mind, which I find to be a little aggressive. So, you know, my thought is always, let's just put it on a cloud and let it float away. Let us gently remind ourselves that we just want to be in our bodies, and stillness in our mind will allow us to be in our bodies, and stillness in our bodies will allow stillness of mind. It's a symbiotic relationship, and it's non-attachment, which is part of a Buddhist principle. Is that clear as mud?
Thank you. That is helpful. Diane has a question. Diane has a question. Diane, do you want to unmute yourself and ask your question?
Okay, can you hear me?
Yes.
Hi, Diane.
Hi.
Diane.
Hi. Thank you so much. It was an amazing presentation. My question is, how would one assess their own personal window of tolerance?
So, you can do that a lot of different ways. So, in gut reaction, breathing rate. There's something that happens in us where we start to get anxiety, and everybody feels anxiety differently. And there is, anxiety is necessary for us to learn. That anxiety, it's called the zone of proximal development, right? You feel that little bit of anxiousness, and it can help you to learn the next thing, right? You go to the next level. And so window of tolerance is very much like that, but we don't want to go to the next level. So the minute you start feeling whatever you define as anxiety, that's the time to just start noticing what's going on. And so if you're not in a learning situation, if you're in a situation where you're out in public and suddenly you start feeling that, trust your body, okay? Because your nervous system is going to take in things that you may not visually take in. So if you start feeling that anxiety, that feeling in your gut that something is just not quite right, then you're in your window of tolerance. You've been activated, right? If you get to a place where you're starting to pant, to breathe heavily, I've been scared enough that my dog ran away the other day. And I was okay until about the third block, and I couldn't find him. And that's when I couldn't breathe. And I knew that I had hit my window of tolerance, because then the tears came. And then I was trying to call my son, and I couldn't get a hold of him. And so I knew that I had kind of moved out of that, and I was in a panic situation.
And would you think that being exposed to EMDR long enough, would that open your window of tolerance?
I think that depending, okay? So if you're somebody who is hypervigilant by nature, or you've had traumas as a child that you have experienced that have been chronic, or your complex trauma where your window of tolerance has been really narrowed, then yes, it can expand it. But we don't, some people's window of tolerance, because it's been so abused on the edges, becomes very wide. And then we don't sense danger. We become very numb to it. So the answer is it depends.
Good, thank you.
It depends. Yeah. Mm-hmm.
We had a comment from Joyce. She said she caught the "you can choose" and "you might decide." She said that was very, very helpful. and reduces resistance to try and exercise. Can you comment on that?
It does, because part of that, doing that is creating a situation that is not oppressive, that is invitational. And so oftentimes when we are in any sort of structured situation, you'll notice that people tell you what to do, whether it's exercising, whether it's being in a class, whether it's, somebody trying to show you how to do something, they'll tell you to do it. And when that happens, it takes away your abilities to make choice. So part of a non-oppressive situation is that you have choice, that you take effective action, right? That you can be present without being triggered back into some other trauma. And that happens in a lot of places. I don't know if any of you have ever had instructors that somehow put you in that place where you just feel oppressed. Or gone to an organized yoga practice where somebody tells you how to move your body. And the agency is important. Being able to, this is your body. You make the decisions about it.
I don't think we have any more questions.
I have a comment.
Okay.
When you did the last exercise just before the meditation where you had to stand up and do some movement, what I noticed was my initial resistance with so much choice. I'm used to a yoga practice where I'm told what to do. And I became aware tonight for the first time that having direction and instruction is actually quite numbing. That I can check out during my yoga practice and just do what I'm told. And this forced me, or, we don't use that language, invited me to check in with myself and make choice about what felt right for my body. So that's a very different experience. It's a much more present experience. So I just really want to thank you for that valuable piece for me tonight, and all the other very thought-provoking pieces that you provided for all of us.
Thank you.
Anybody else have a comment before we close?
I found this quite useful as a way to look back at my journey. And this provided some words for some things that I am aware of, but just didn't ever quite put into words yet. So I thank you very much for presenting this.
Thank you. Thank you.
So thank you, Jacqueline, so much. You can all reach Jacqueline if you want from her email. I think your phone number was up there as well.
Yes, yes.
CEUs, Daniel, do you want to just repeat that piece again so that everyone can have that?
Sure. If you need CEUs for tonight's presentation, please email us at info@d2counseling.com. You can pull that off the website too, which is d2counseling.com. If you missed Jacqueline's email address, there's contact information for her there as well.
I'm going to put my email in the chat box real quick.
Okay. So glad you all joined us, and we will see you next month, I hope. And we will keep you posted whether we continue virtual or we go back to live. That is still undecided for next month. So thank you all. Great to see your faces. Thank you, Jacqueline.
Thank you. Have a good evening.
Thank you. Bye.
Thank you, Jacqueline.
Bye.
Bye.